Hello everybody, this video is about treatment of osteoporosis. If somebody is unable to tolerate bisphosphonate like Fosamax, Actonel, then what do? We have lots of options. I have this 70-year-old lady with her T score being minus 3.3 in the spine and hips. High risk of fracture. She was diagnosed 10 years ago. I'm seeing it second time, and repeat was DEXA scans showed worsening of osteoporosis. So I'm going to start on Prolia. I wanted to talk about Prolia injection, indication, and contraindication. Prolia is an injectable medication given either subcutaneously or by infusion. The generic name is Denosumab. Is a monoclonal antibody used to treat osteoporosis and reduce fracture risk. It works by blocking RANKL. It's a protein, name of a protein, RANKL, a protein that activates osteoclast cells that break down bone. So result is reduced bone loss and increased bone density. FDA-approved indication, postmenopausal women with osteoporosis. It's indicated in women who have high risk of fracture, history of fragility, fracture, or very low bone density, T-score less than minus 2.5, and failed or cannot tolerate oral bisphosphonates. Men with osteoporosis, used in men who have osteoporosis with high fracture risk, history of vertebral or hip fracture, or cannot tolerate other therapies. Glucocorticoid-induced osteoporosis. Patient on long-term steroid like prednisone daily for more than 3 months, with moderate or high risk of fracture. Particularly useful when bone loss is rapid. In patients with hormone deprivation, men receiving androgen deprivation therapy for prostate cancer, and women receiving aromatase inhibitor like tamoxifen for breast cancer. It's used to prevent treatment-related bone loss. When is high fracture risk defined? So typically includes prior hip or vertebral fracture. So really important, even patients with osteoporosis, to check their lumbar spine and vertebral spine. Many those vertebral fractures are asymptomatic. There will be wedging of the vertebral bodies, and sometimes patients have symptoms and sometimes they don't. And so also the hip x-ray, prior hip and vertebral fracture got to be ruled out. And the T-score less than minus 2.5, osteoporosis T-score plus high frac score. High frac score is usually hip fracture risk of more than 3% for next 10 years, and for more than 20% 10-year major osteoporotic fracture risk. Dosing is 6 milligrams subcutaneous every 6 months. Got to make sure that calcium and vitamin D is adequate. Before starting, check calcium, and if calcium is low, got to be corrected, and check vitamin D. A dental evaluation sometimes is important because this kind of patient can, in rare cases, develop osteonecrosis of jaw. And do not stop Prolia all of a sudden. Stopping can cause rapid bone loss and vertebral fracture. So you got to figure out transition to different medication. Normally when I prefer Prolia is somebody cannot tolerate bisphosphonates and they have severe osteoporosis, T-score of less than minus 3.0. In this case, that's what I have. So she'll be started in Prolia injection. Thank you for watching.